Hi, I'm Dr. Dan Ratner, and we are back on Crushing Doubt for our Monday Q&A, always at the same time, 6 p.m. Eastern, 3 p.m. Pacific. So we're going to start with one of our preloaded questions, as we often do, because right here at the beginning, people don't often come on and immediately ask a question. But I did want to also remind people, if you want to come on to talk to me, it's www.callcrushingdoubt.org. And you can come on either on video or on audio. So our first question I meant to get to last week, but we did not have time. So this is for you, Rick R. I have hyperacusis. It's an extreme sensitivity to all sound. I damaged my hearing from loud music. So there is actual damage somewhere deep in the inner ear. At least they can document the high frequency hearing loss in my left ear. But there is no diagnostic test or treatment for hyperacusis. A very small percentage of us have become extremely sensitive to all sounds. The basic question is, oh, it went away. Basic question is, actually, I remember it, so no worries. The basic question is, can you have TMS or a mind-body issue on top of a purely physical issue? Oh, it's back. No, that's the second part. All right, hold that one there, okay? So I'm going to answer that question first, then we're going to get into this. The fact is you can have a purely physical issue that also has a mind-body component. In my experience, though, that's on the rare side. What I do is I rely on the doctors to rule out very clear medical conditions that are life-threatening or permanently altering. So what Rick is describing is that he has some hearing loss that is likely to be biologically determined at this point. So there may be only a certain level to which he can get to. But what we're going to find out in what happened to him next shows that it was much more a mind-body issue than otherwise. And that's something he and I may work on. So here's what he says. But here's the mind-body part. I was isolating. Fear of sound had me staying in a completely quiet environment, in completely quiet environments, never leaving the house. And the sound sensitivity was getting worse and worse. Then a friend moved into my apartment and started dragging me out to cafes and parties and just wherever. Guess what happened? I never would have guessed this. I'm kidding. I knew exactly where this was going. The sound sensitivity got about 85% better, and I had no medical treatment at all for the hyperacusis. As I said, there is no treatment for it anyway, but clearly I stopped focusing on it and I started enjoying my life, and something changed. So I had 10 or 15 good years when I was able to enjoy life. The ear wasn't perfect, but it was a lot better. But some major life stressors occurred and the hyperacusis got worse. Okay, now what does this tell us? I really think it's very important that we always think about the fact that we're not going to dismiss any data. Well, Rick basically did a longitudinal study, of over probably 18 years. And during that time, his true hyperacusis, which was biologically determined for whatever reason, got much better for 10 or 15 years, all from a change in behavior and a way of thinking. And then when it got worse, he was able to recognize it was in relation to stress. So what this tells us is that even a completely physical limitation has its degree to which it can be very much altered by the mind-body process. So I wanted to highlight this not only to answer the question for Rick. Yes, I think it's possible to have some physical issue that is also a mind-body component. But in my experience, the mind-body component is by far the dominant factor almost all the time. Now, if we're talking about like Beethoven going deaf, we couldn't get him hearing back, even if I existed during that time. So that answers that question. We're going to get back to some preloaded questions if there's time. And again, if you're watching this in Europe or Asia or wherever, or Australia, where the time difference doesn't really allow you to watch this, I will try to prioritize preloaded questions from those areas because you won't have a chance to voice them otherwise. But we do have a question coming in from Matt Anderson. Welcome back, Matt. Good to see you. He says, I know that the unconscious mind has a direct route to emotions, but after having a dream about power recently, does it make sense that the unconscious mind has just as much influence to power? Okay, I got to read that again. That's a good question. I know that the unconscious mind has a direct route to emotions, yes, but after having, yes, okay, so here's the thing about the power column and the emotions column, and I will say this just in general. The columns have a lot of overlap, and they have a lot of flow to them. One of the reasons that it is set up that way is that I wanted a system that accounted for the reality of your experience, and that means there's going to be a lot of flow between the different columns. The columns organize, but they also flow into each other. So the unconscious mind has influence in all three columns. Even in the doubt column, you're going to have a lot of unconscious doubts. It's one of the reasons why when people come to see me and I help them articulate their doubts, a lot of times they're like, oh, yes, I had that doubt, but I didn't realize it was at that level, or I didn't realize that it included this part of the experience. But power and emotion, those two columns are even more linked when it comes to the unconscious. So, Matt, I would say that actually I had an experience with this myself. As you become more powerful in your own waking life, you'll actually become more powerful in your dreams. I used to wonder this. I didn't feel so powerful in my life, and then I'd have a dream where anything could happen, but I was even limited in my dreams. So your power level tends to match consciously or unconsciously. And you can have movement in both as you start to make movement, but the movement actually tends to come in the conscious realm because you're asserting some will. So we have a question from Amy C. Welcome back, Amy. In your experience, are there specific correlations between what emotions we feel and where we feel them in the body? Great question. And Amy, I'm going to say this. I don't actually have a complete answer on that yet. There are some things that I'm still studying because, I'm not going to ignore data. So different data is coming in for me personally, also, in the research, but I do tend to rely on my own personal experience a lot in this. And also the experience of the people that I work with. And I will say this, there are some correlations between emotions and where we feel them in the body. I have certain symptoms that are always the same thing. It's the strangest thing, but I get a rush of adrenaline down my right side. And that is what happens when I'm feeling over-competitive. I don't know why that is. I cannot explain it, but I can tell you it is true 100% of the time. If I get that symptom, I tell myself, you know what? The competition's not worth it here. I'm backing off of this. I don't want to have this symptom. I do have other symptoms that come up that relate to things. And this is part of how I discovered the doubt column. I had when I was having all that back pain, I had a very tight muscle in my back. I called it the eel muscle because it felt like there was an eel in there. It was so big and strong. It was not pleasant. And it would wiggle around when it would spasm. So it was horrible. What I found is that related to more of emotional distress and doubt. But what I found is that spasms related entirely to fear. So here's what I'll say. A lot of times the symptom that comes up, the way it makes you feel is relevant. Spasms made me feel terrified. And what that signified is that they came from terror. So the feeling that you get with the symptom does tend to correlate with the kind of emotional experience you're having. And then there are some strange things where your body and mind just have this link and they say, okay, when you get over competitive, you get that adrenaline drip. Or here's another one. When I just sit down and then my kids call for me, my heel hurts. This actually sometimes happens with patients also, I will admit. If I'm on vacation and people need to contact me or something, my heel can hurt. Why that is, I don't know. That's something we need to keep asking questions about. But Amy, I love that question and keep the questions coming. I do also want to say, if you're new here or haven't already, click subscribe, ring the bell for notifications, hit like if you like what you're hearing, because it helps me to gauge what kind of content you guys are liking. And then put your comments below. I do answer directly. I think people have seen I'm pretty religious about it. I get back to everybody. If I don't get back to you, it actually usually means that for some reason YouTube deleted that comment. So don't be afraid to prod me and say, hey, can you get back to me here? Because I mean to every time. We've got a question coming in from Christina Carlton. Welcome back, Christina. Hi. You have talked about different ways the brain/body creates symptoms, neural pathways, peptides, etc. How specifically does the brain body create stiffness and tightness? Okay, great question, Christina, and I will try to do it justice, but I will say there's certain areas that I can explain better than others. This one I'll be able to explain very well from a general standpoint, but from a specific standpoint, and that may be what you're asking, we need to know more. So here's what I'll say. First of all, there are different theories that have been brought up for how mind-body processes work. Sarno's original idea was that it was oxygen deprivation to the muscles that caused pain. that's a potentially plausible explanation for pain in muscles, but it always struck me as overly specific and not explaining enough of the theory. That felt like what I call like, the circular orbits of astronomy as opposed to elliptical orbits. Only got it right 80% of the time. And in fact, that was probably even worse. Oxygen deprivation, I do believe that does happen, and I do believe it causes pain, and I do believe that comes from a mind-body process, generally speaking. Although with anaerobic exercise, where you run out of oxygen, you get lactic acid in your muscles, so that also can just happen from a purely biological process. But that doesn't explain enough of it. Neural pathways also don't explain enough of it, because the way, at least not the way it's described, I believe neural pathways exist, but the way it's described is that you get these grooved patterns in your brain that are going to continue. But if that was the case, then why do so many people have the ability to shut off pain so fast? And why do we all have the ability to have pain come on so fast? So the neural pathway argument doesn't make sense as an explanation. I think it is explaining some of the biology and physiology that we see. The one that makes the most sense to me is peptides. I read about this in Candace Pert's Molecules of Emotion. Peptides are the neurotransmitters of the body. So for those people who don't know, neurotransmitters communicate between cells in the brain. Peptides communicate between the brain and any cell in your body. What that means is the brain can tell any cell in your body to do anything it wants. And it can happen lightning fast. So I tell people this with IBS all the time, this kind of thing. Your mind can channel into the body within milliseconds, really just instantaneously, because it's linked. So when it comes to, having diarrhea or something like that, usually that is almost always caused by the fact that the brain has told the cells to evacuate water and send it into the colon area. That is what happens with diarrhea. That's why it comes on so fast. So I'm saying this, Christina, because this actually relates to your question, which is specifically about stiffness and tightness. Now, what is the mechanism that's happening there? The peptides are really telling the cells to do that. But essentially, the process of stiffness and tightness is about muscle tension. And so it is sending a message to tighten up those muscles. The reason that mind-body works so well is that if you're not afraid of it and you change the message of the brain, that message gets alleviated right away. This is why you can alleviate symptoms very quickly. So Christina, let me know if I answered that question, and Matt and Amy as well. If you have follow-ups, let me know. Keep the questions coming, but we do have another preloaded question, I think, coming up, which we did not get to last time. So I do try to carry them over from last time. I try to honor all requests to get these in. I think we have a question coming up from Diane. So Courtney, bring that to the screen when you get a chance. Here it is. Okay. Diane L. I listened to a podcast on migraines. It wasn't mine because I haven't done one yet, but I will. And the speaker said she felt a little sad that she had spent so much of her adult life in pain and not pursuing her passions. I realize how much grief and sadness I am carrying around for the same reason. Am I going to feel empowered by just feeling well and not having to process these feelings? Will I do better if I journal my feelings around this? Or will simply acknowledging them be enough for me to move on? Let's leave this up on the screen because I want to think about this a little bit. Now, it's actually going to depend, Diane. There are people who, when they get better, it helps them feel powerful. It helps them feel free. They don't tend to mind things so much anymore. They feel more relaxed. So there are people who they get better and they don't have to go back and process the emotional experience. But much more often than not, people do have to process their grief and sadness. Now, the interesting thing is you bring up journaling. Journaling, I will say, though, it works for some people and not for others. I get this question a lot. Why, when I journal, do I get more pain? Or why do I journal? Am I not getting anywhere? So for some people, journaling is fantastic. I know Nicole Sachs uses Journal Speak, and it is a very, very powerful tool, especially for people who won't let in a certain emotional experience. So it is something to try. But if you find that it's not working out so well, it's causing more pain, or you're getting frustrated, or you're not getting anywhere, there's another way to do it, which relates to something that I do. It's the power column and the core narrative. I just had this experience recently. I was talking to someone I had seen before. She and I had done the emotions column, and we had even done the power column. But she circled back to me when she heard my video on the core narrative. And she said, I want to do that. So we went ahead and we dealt with the core narrative. Now, for those who need a reminder or people who are new here, I'm going to explain that. The core narrative is the central part of your emotional experience that captures the main themes of your life in a way that describes you in a positive and accurate way. We have lots of ways of describing ourselves negatively, and that's not what we're looking for here. We're looking for a positive one. By the way, Patrick, I do see your question. I'm going to get to that in a second. So when you get to the core narrative, it's very organizing of your central issue, and it connects a broad, high-stakes theme to a specific experience. I can give examples of that. In fact, it could be a good thing if you guys are interested. You can always come on here and say, here are my kind of central issues. How would you organize it into a core narrative? And I can give you examples of that. Although in the video, I do that as well. So when you have that, then there's an action step that is connected to it. And usually that action step is something along the lines of, I'm not going to live that old way anymore. I'm going to make choices for myself that are stronger and more powerful, and I'm going to be in my own corner. So the patient I was talking about, she and I did this core narrative thing, and then she found herself having immense grief over her mother not loving her the way that she felt she needed. And, you know, just to validate her experience, by the way, her mother did not do a good job validating her as a person or showing her love. So it wasn't just like in her mind. It very rarely is. Most of the time people carry these feelings, and it's for a reason, and your body's telling you the reason. Okay, we can bring that question down. I just wanted to highlight that. So Diane, the answer to the question essentially is it can vary. And so I think you would want to explore it. But if you're finding that you're able to move on without processing it, that's fine. A lot of people have that. And if you're finding that it's not going away, then it might be a time to look at the power column and the core narrative, or keep journaling. That works for some people. We have a question from P to the @ also known as Patrick. Welcome back. A lot of medical professionals, PTs, surgeons blame joint pain, back, knee, shoulder on wear and tear. Is this ever true, as in high use cases such as athletes, or is that a cop-out diagnosis? Thanks. Fantastic question. I'm always so impressed by the audience and what they bring. Wear and tear does actually happen, but it does not cause pain ever. So your question is this ever true? The answer is no. And in fact, there are lots of studies that show this. In the mid-90s, we started studying asymptomatic people without any pain, and we looked at their structures, and they found a lot of interesting things. Now, when I had Georgie Oldfield on, she brought a couple of statistics up in her TED Talk, and we talked about it when she was on my show, that they looked at athletes, and the percentage of athletes that had major tears without any pain was staggering. The one that I'm remembering offhand is that hockey players had 77% of hockey players had tears in their groin areas and in their knees, and most of them had no pain. 77%. That is a staggering statistic, and it's not just in hockey. That just happened to be the one that was the highest, so I remembered it. All of them were above 50%. Pitchers in baseball, over 50% of them had tears in ligaments and tendons in their arms. These are the same players who are getting Tommy John surgeries, and they're out for a year, and then it takes them a year and a half before they can really get back on a mound and be effective. And as it turns out, there is no correlation with the pain. None. I understand the potential logic of it, but it turns out that there's none. So I'm not sure I would necessarily call it a cop-out diagnosis in one respect, although I agree with that terminology, generally speaking. They don't know what they're saying. They mean well, generally speaking. But if you're thinking from a mind-body standpoint, it's a complete cop-out. It's not true. And in that sense, I would say it's a cop-out diagnosis because they're not being scientific enough. They're not being devoted enough to really find out. So I do think it's a little bit of lazy science at the very least, if not an actual cop-out. Great question, Patrick. Let me know if I answered that. Okay, Matt has another question. We hear about COVID long haulers. Oh, great. I know where this is going already. Great question. I love you for bringing this up. Continuing to suffer from brain fog, chronic fatigue, etc. Have they most likely transitioned to MBS due to being infected and the general stress of the pandemic? Okay, Matt, here's what I would say about it. I want to be a little bit cautious about this just because COVID is such an unknown thing. So I can't know for sure. And I would want to wait until, some of the big level names who are studying this, Dr. Fauci and all the rest of them, weigh in on this. I just don't know. I don't know whether COVID has lasting effects or not. What I would say is this, and I can say this for certain. I would not at all be surprised if the vast majority or all of them have transitioned into a mind-body syndrome. So what I would say is we need to keep an eye on this, and we need to keep considering maybe it's all mind-body. The one thing that's great about mind-body work, you don't have to commit to it. You can just try it because it doesn't harm anything. We're not giving you a medication. We're not performing a procedure that can't be undone. You can just try it out. And if it starts to work, well, it was that. So any of these COVID long haulers, if they tried out, maybe this is a mind-body thing, and they really tried it on, really tried to believe it, because I would guess it is. This is my guess, but I'm being cautious about it because I don't know. I would say I'm about 90% sure that those COVID long haulers are having mind-body symptoms. And why not? Imagine something that could cause more doubt than an unknown epidemic that has all kinds of pathways we don't know about. That would cause a lot of doubt. So the chances of there being mind-body reactions out there, I would say the chances of it being out there at all is 100%. There are people who are having mind-body symptoms. They're not having a COVID long haul effect. Are there some who are having some kind of COVID-related thing? That is possible. I don't know for sure. So I hope that's a good enough answer for you, Matt. We're going to keep looking at it. That's a great question. Matt also makes the observation, this is in relation to the hockey data that I was giving, 77%. Wow, that is a wild stat. I never played hockey, but I give them so much credit for getting their teeth knocked out and continuing to play with ease. I mean, look, it's really true. When we look at athletes, one of the things that they say all the time is it's mind over matter. And I used to think that what that meant is, yeah, you get hurt, but you just play through it. You just grit it out. But I actually have come to see, I don't think that's actually entirely what it is. I think what it is they use their minds to change matter. I don't think they think of it that way, but they use their minds to change their experience of matter at the very least. I take it a step further. I think you can use your mind to change matter. Now, not any matter. You can't, heal a broken bone from mind-body work. But with respect to those peptides that can come in and maybe decrease inflammation, I've done it myself. I know this may sound crazy, but I was playing catch with my nephew once, and on the follow-through, I hit my thumb on my leg, and it jammed my thumb. And I thought to myself, okay, wait, don't assume, and it really hurt. And I was like, don't assume that this is going to stay really injured or swell up really bad. I'm going to give myself a chance to challenge this. And I challenged it, and I said, I don't think it's going to swell up. I think this will be gone in like 2 minutes, because right now I'm dealing with what I would call a trigger. So I tried it, and guess what? It didn't blow up at all. It was fine. Did not get bad. Now, some could argue, well, that was just total coincidence. Sometimes it's a bad injury and sometimes it's not. I'll tell you though, this one felt totally real. And meanwhile, I've done this many times. On the basketball court, one of the times when I get a mind-body kind of experience is when I go in for an easy open layup. Happens all the time. And the reason is because I'm feeling pressure at that moment. I'm like, I don't want to miss this one. This one's so easy. And so I often get a pain in the back of my knee, and I have to work it through. I say, no, that's not an actual strain. This is a mind-body experience. And minutes later, it's gone. I do this all the time. So I can't say that's always what's going on, but usually it is. Okay, so we got a little bit of a break in the action in live questions, so I think we'll bring up another preloaded question. Let's see what's coming up next. But I really do find those stats about athletes fascinating. I work with another guy who's totally convinced, just like I am, that all these Tommy John surgeries are actually not necessary. And wouldn't that revolutionize the game if any of them were listening to what I'm saying here, or what other people who say this too? But yeah, I mean, all of these athletes, repetitive motion leads to wear and tear, and it just doesn't lead to pain. Okay, so Courtney, do we have the next preloaded question? You're working on it? There it is. Okay, this is from Dan C. Is an increase in crying considered TMS? Interesting. Let's leave this one up for a little bit because I'm going to need to think about it. The symptom imperative. So for those of you who are relatively new to this, the symptom imperative is when you get rid of one symptom and then another one pops up. And that's because the mind-body process is trying to fool you into thinking, no, okay, you won't buy that? Fine, I'll try another one. So Dan C says, as you say, crying is something mind-body. I agree with that. But for me, it is paired with certain thoughts of my present/past. It seems that a certain floodgate has opened up the last several weeks as I have been gaining deeper insights through some of the things you talk about. Symptoms sometimes go down after crying. Okay, this is a question that requires a lot of nuance in the answer. Your first question is an increase in crying considered TMS? Well, that's so hard to say. Here's what I'll say. Crying is a mind-body process. When I was, writing the chapter in my book that was thinking about how to describe a mind-body process, I laughed because I realized I've been thinking of all these mind-body processes, but the most obvious emotional experience of all, I hadn't included in it. But crying is sadness channeled into your physiology. You get sad and you cry right then. It's not delayed, by the way, and that's something we need to keep in mind. Symptoms are not delayed. If you have a delayed symptom, that's a misnomer. You have a symptom right then because something's going on right then. So is this the symptom imperative? So listen, I would say an increase in crying can happen because you had a death in the family. Is that TMS, which is what Sarno called the mind-body issues, tension myositis syndrome? Not if it's connected to an obvious psychological experience of a kind of traumatic level. But I would say an increase in crying, I wouldn't call it TMS. I would actually call it you've moved off of a mind-body process and into one that's more true to your emotional world. So if a physical symptom is happening because of your true emotional world, you're aligned with yourself, I wouldn't call that a mind-body process, a mind-body issue. I would call it a mind-body process. I'm parsing words, but hopefully that helps. Is it the symptom imperative? I wouldn't call it that, because the symptom imperative is when the body tries to move to a new distracting symptom. And that's not a distraction. It's right to the core of what's happening. So when you say, Dan, that a certain floodgate has opened up the last several weeks as you've been gaining deeper insights, and that the symptoms go down after you're crying, to me, that's not another mind-body issue coming up. That's actually the solution to the mind-body process. You're going right to the source. So the distinction essentially is, what's the function? Would we call it TMS or a mind-body issue if the function is either to distract or communicate? Yes. Do we call it that when you've received the communication and it's making sense and it's doing something in your mind-body experience, but aligned with you? No, that I would not call TMS or a mind-body issue. It is a mind-body process, but it's not one of those issues that we need to treat. In other words, that's on the right track. You want to keep doing what you're doing. And I think a lot of the work that I do with power tends to lead to those things. That's similar to the woman I was talking about before. Okay, we have another question from Patrick. Here we go. Have you discovered implications for weight loss struggles? It may very well be just a biological process like a bone healing and determined by food quality and quantity, but just curious. God, you guys asked some fantastic questions, and it allows us to kind of dance around to different parts. So there is a book that I read. I'm going to need to remember what this was called. It is called The Slow Diet, I think. I'm going to need to look that up. The Slowdown Diet. That's what it's called. I'm going to Google that to remember. Actually, I'm going to tell you what, I'm going to have my producer Google that so we don't waste time on that. So either Greg or Courtney, can you Google the Slowdown Diet and who wrote that? And I'll tell you about that. So here's what I would say. I have had this experience. One of the primary experiences I've had is with my wife, who is a type 1 diabetic. When she is stressed out, she cannot metabolize insulin. It doesn't matter if she's super stressed out, she can take a huge amount of insulin and her blood sugar won't go down just an iota. So the way I think about that is that your mind-body process does have control of whether things get metabolized. What are the implications for that in weight loss struggles? To me, okay, it's written by Mark David, The Slowdown Diet. Thank you. Thank you, Greg. So that's something to look up. And it talks about that essentially how you digest food depends on who you are when you eat. I'm going to say that again because it's kind of a striking statement. How you digest food and how it metabolizes in you depends on who you are when you eat. So happier people digest food better. Happier people actually receive the nutrients better. And happier people have an easier time losing weight. This is a big deal. So listen, we've got to talk about this. We probably have to study it more to make sure that that's true. We have to study it more to find out how much it's true. But I can tell you for sure it is at least partially true. I've seen the experience myself. I've even had the experience myself. When people are happier, they lose weight. Not the other way around, by the way. It is not the case that if you lose weight, you become happier. Look, some people might have that experience, but that is an idiosyncratic experience. What I'm saying is something that everyone has, is that when they're happier, they lose weight. So when you see somebody who's overweight, one thing that you can keep in mind is probably some of that weight gain came from not being happy. That's not always going to be the case. There are people who just are eating a lot and, not watching their intake, or maybe they're not eating well. So I hope that answers the question, Patrick, but I will say it's not just a biological process. Our whole mind-body system is one. So whatever's happening in your body, the mind does have implications on that. And that's going to be true with eating and weight gain as well. Now, it is true that if you're going to eat an entire large pizza every single night, you're going to gain weight. That's definitely going to happen, and that's not a mind-body process. But at the same time, we'd be urged to eat. That also can be a mind-body process. So I find there are times where I'm like hungry. I feel like I got to eat something, and I'm like, but I just ate. Why do I need to? And then I realize, actually, I'm also really tired. So sometimes you have to go to a different emotional need, a different physiological need even. And a lot of times people who are gaining a lot of weight or having trouble with weight loss aren't going to the other things. They're not maybe giving themselves other pleasures, and they just are going to their go-to. So it's a complicated topic, and I'm not going to say that it's entirely mind-body at all. I just want to say there is a mind-body component to it that we should really look out for. Great questions. All right, I think we got another break in the action, so we're going to go to another preloaded question, which should be up soon. So I'm curious for the people out there, though, what you think about this, and I'll take this time also to say, if you're new, click subscribe, ring the bell for notifications, and hit like if you like what you're hearing. It gives me good feedback. And then put your comments below. I'm happy to talk to you about anything and everything. We've got a question coming in. This is another return questioner, Lorianne. Under which column would forgiveness fall? I'm referring to forgiveness of others who have wronged you. And how does that play into TMS? Again, these terms, TMS, PPD, MBS, mind-body issues, they all mean the same thing. They've just been coined by different people for different reasons. Psychophysiological disorder was coined by people, that's PPD, who believe more in the neural pathway argument, which of course neural pathways are real and are happening, but they think the fear and feedback loop is the main part of the issue. I think they're definitely onto something with that. I just think neural pathways can be changed fast. Anyways, that was a total aside from the Lorian question. Under which column would forgiveness fall? Well, here's the thing. That could fall under any of the columns, and I'll explain why. Forgiveness could fall under the emotions column, of course, because you could have an emotional theme that really kind of indicates what you feel about forgiveness. So it could be, I always had to forgive people too quickly, and that was a self-betrayal. That's an emotional theme right there, and that's one forgiveness theme. But here's another. I don't want to forgive people because I feel like it means they got away with it, and that would be too much for me to take. That's another emotional theme. Now let's move to the doubt column and talk about how forgiveness can fit there. Forgiveness could come in the form of, I don't know if I can ever get better because I don't know if I can ever forgive. So do you see how these are themes that relate to the different columns? In the power column, and I think this is where forgiveness is probably the most important. So if I had to say which column is this the most important in, it's the power column. The power column is whether you're feeling good about you, whether you feel aligned with yourself. And that comes in the form of your relationship with yourself, your relationship with others, and your relationship with your symptoms. Well, your relationship with your others is obviously the one where forgiveness is a particularly looms particularly large, but it will loom particularly large also, and maybe even larger if you think about it, in your relationship with yourself. Can you forgive yourself? I was working with somebody not too long ago who couldn't forgive themselves for having mind-body issues. She said, so you mean I caused this? I always say this. No, you were not the cause. You did not get here alone, but you are the solution. That's an important distinction. Just because you're the solution does not mean you were the cause. It's a process that you didn't know about. You had no way of knowing about it, but now you do, so you have a chance. So when it comes to forgiving other people, though, Lorianne, I think the idea is that you need to get aligned with yourself. I will say this, and this is important. You do not always have to forgive. You just have to come to peace with what you think about things. There are people in my life who I'm not going to forgive. I won't. And it's not bad as long as it's not eating me alive. That's when you need to find a way to forgive, is when it's eating you alive. You don't have to do things for these other people who did you wrong. And a lot of people will have done you wrong. What I like to do is to get it codified in my mind. Why did it happen? Who is this person? What was their limitation that led to this? It's not about forgiveness. It's about understanding. And I don't mean understanding them. I just mean understanding the concept of why did they do what they did? And why did I get into this with them? Because then we can learn from it. It's about understanding and learning much more than it is about forgiveness, unless the lack of forgiveness is eating you alive. That is when you've got to find a way, not necessarily to forgive, but to be able to let it go. There's a big difference. People don't often talk about that. They talk about it like forgiveness is the holy grail of getting past things. That's just a way of letting go. If that's the way that you want to go about letting go, that's fine. But some people, their healing comes from never letting go. I'm never letting go of that hurt. I'm not going to let it eat me alive, but I'm not going to let it go. And I'm going to use it as fuel. So that's something that I do. I talk about this a lot. You want to use your aggression as fuel to get better. You know, I use it against my symptoms. I use it when other people are, not behaving so well. I don't, actually, this is funny. I can't say this on the air in full because it has a profanity in it, but I was talking to a patient today and we were talking about how there is a way to have a pleasant FU. And that's a great thing to be able to do because it's not even obvious. It's just something we know within ourselves. It could be as simple as, I'm not going to dignify that with a response. And you don't even need to say it. You just don't. And that is what I call a pleasant FU. And she coined the phrase, so she gets credit for it. But, I think it's a very healing thing to be able to do. Now we have a couple of questions I want to get to here. A lot of my this is from Patrick again. A lot of my urges to eat seem completely brain initiated, not reflective of real hunger. Interesting. I think that's often true. Now, look, we are biological, physiological beings. We're going to get hungry. But I had an experience. I actually used to get hypoglycemic a lot. Or at least I felt that way. And I felt that I had to eat. So my wife's a type 1 diabetic, as I mentioned. I was very curious. I wanted the data. I was feeling hypoglycemic, so I tested my blood sugar, and it was 100, which is exactly what it should be. So I wasn't actually hypoglycemic. I was having the experience of hypoglycemia. Now, and I was having something real happen in my body physiologically, but it wasn't a blood sugar issue. So, you know, what's going on in the body? This is similar to Christina's question about stiffness and tightness. What's going on in the body at such moments? I don't totally know. I'm not an expert on physiology and anatomy. I check with doctors about these things, but I will say this. I have a firm and complete belief that any cell in the body can be altered in almost any way by the mind when it needs to be. And it is true for me. A lot of times I have an urge to eat when something else is going on. Eating between sessions, it happens all the time for therapists. And, you know, you can even feel depleted by giving, especially early in your career as a therapist. You don't learn how to do this. So you just kind of give, and then you're like, oh my God, I'm so hungry at the end of the day. And you have to learn how to titrate things. So that's just an interesting thing. Now, Patrick's saying, I've also tested my blood sugar when feeling that way. And that's the same thing. Good numbers, but feeling hypo. Yep. Isn't it interesting? And, you know, whereas my wife, she tests her blood sugar and it's truly down. That's because we have functional pancreases. So we can't make certain things happen. Just like you can't break a bone with your mind or heal it. You can't do certain things, but you can have the experience of all kinds of things. Anything, any process that can happen, your mind can make it happen if it is physiologically possible. We don't have the possibility to lower our blood sugar because our pancreas works against it. Homeostasis stays in order in that area. I hope that clarifies it. Great question, and we can explore it more. Okay, another question from Matt. More curious, but is there a head organization that oversees the work studies of those in the MBS field? Or is it still mostly independent work with collaborations forming as new relationships build? It is the latter for sure, Matt, at least as I understand it. But I will say this, the field is making some good gains in this, especially the PPDA, the Psychophysiological Disorders Association. They have a great website. I believe it's www.ppda.org or com. I'm not sure. Fiddle around with it and you'll find it, or I'll bring it on the next podcast. So they have become more of a central organization, and certain figures in the field have done very good work trying to kind of oversee, especially the studies. It's .org. We just had it pop up. Thank you, Greg. I have a great production team here, Greg and Courtney. Thank you both so much. So especially the studies are getting more centrally organized. I had on Howard Schubiner and Dave Clark. Dave Clark is the founder and president of the PPDA, and Howard Schubiner, who is part of that, has done more research than anyone I know in the field, and or at least he's overseen it. And both are greatly appreciated. I know they've also worked with Alan Gordon a lot, and I would like to have Alan on the show at some point. He's a bit on the busy side, so we'll see if we can get him, but I'm going to work on that. So they started, though, Howard, I believe it was Howard and Alan, but I'm not actually totally sure. Howard started a clinic, though, in Las Vegas where they do actual outcome studies of mind-body treatment. Now, this is really important, and I'm very impressed that they're doing it, and I think it's wonderful that they're doing it because everybody's got their interests and strengths. Research it's not really an interest of mine to do. I have lots of studies that I'd like done, but I want someone else to do it, and someone who's more talented at it than me because it's not my thing. But also everybody's got limited time. So we are all doing our own things. I think there is a concerted effort to try to connect. I had Jeff Axelbank, Dr. Jeff Axelbank on 2 times, but the second time we talked specifically about this. Is there a way to address the various organizations and the various individuals so that we can start to make inroads into having a more collaborated effort to get the message out there? So those things are coming. I also will say I'm going to be beginning to train people in my short-term consultations because they work well, but there's only one of me. So I want to continue to work to get people the resources they need. And it's another way that we can actually we could even start studying these. Maybe I can collaborate with Howard or Dave Clark or somebody else and study the outcomes of this. So it's not something that I'm like swearing off and I'll never do. We're all going to keep working at this. So I want to throw it out to the audience. If there are any last questions, happy to answer them. But of course, I will be back here next week, and I do answer plenty of questions in the comments on the videos. So I'm not seeing any. We do have one. We have another preloaded question. I think we can take the time to answer that one just to squeeze it in. So Courtney's going to bring that up if we do have time. Let me see if we do. Okay, looks like we do. So I do want to thank the people who brought up the questions live and spent time with us here. I hope that I've done the job to answer them. So which question do we have coming up to finish up on? I like to finish up on a question rather than just fade away. Got it? Here it is. Okay, from Carolyn. Is it possible to have more than one core narrative? I think one is based on not being, okay, she's talking about her own core narratives. I think one is based on not being dismissed, which makes it hard to let go of pain. The other one feels more connected to having confidence in my ability to know what is best for myself, trusting my own intuition. How do I reconcile the two? Another great question. I always say that, but it really is always true. There are no dumb questions. I think, in fact, a lot of my work is based on questions. Ask your questions, get them answered. So I love this one, though, because it really does get at something at the heart of the core narrative. I tend to think that a core narrative is most helpful when it is one thing, but most core narratives combine more than one idea. So your core narrative can easily combine being dismissed and not being able to trust yourself or your own intuition. Think about it this way. You could say, I was dismissed so often that it interfered with my ability to trust myself. And now that is getting in the way with me being able to trust my reality and not respond to being dismissed all over again, because that's re-traumatizing. Now that was a mouthful, but that's fine. Your core narrative can be a mouthful. It should capture your main ideas. Don't leave anything major that feels incredibly central out of your core narrative. Then you can talk about what action step am I going to take about this. So I'm glad we got that question in, because a lot of people have had questions about the core narrative lately. We had my video out on it in the Mind-Body Connection series this past week. So check it out if you haven't seen it. A lot of people have questions about it. I think that it can be very helpful in explaining what to do and how to develop yours. And like I said before, it can lead to a lot of powerful changes like the one that Dan experienced, or the other person that I referred to. I'm not going to say their name because I asked for confidentiality to be waived for me to do that. So these are important ideas, great questions across the board. It was a pleasure being here with you all. I tend to feel sad at the end because I'm like, no, I want to keep answering questions. I actually do. So I will be back here next week, and I look forward to it. Thank you so much for tuning in. If you haven't already, click subscribe, ring the bell for notifications, hit like if you like what you're hearing, and put your comments below, and I'll get back to you personally. Thank you again for watching.